What structure is indicated as A on this image? So this is the pubic symphysis and this is the bladder. So I think it's the retropubic space. Yes. Retro means behind and pubic refers to the pubic bone, and you know that this is the pubic symphysis here. What structure is C? So this looks like a muscle and it looks like it's going down towards the leg here. So that is the psoas major muscle. And the psoas major connects it like attaches to the lateral sides of the lumbar vertebrae and it goes downward towards the femur. And then what structure is E on this image? And that is the iliacus muscle. Iliacus muscle, okay. So this is, if you look here, this is the psoas muscle, and then this is the iliacus muscle, and then they combine here to form the iliopsoas muscle. So it's shaped like a Y, and they have two separate branches, and then they combine to form the iliopsoas muscle. What plane was this image acquired in? Looks like an axial. It is an axial. Which muscle forms the inguinal ligament? External oblique. So the inguinal, I feel like it's usually indicated as this area here, and then the external oblique is around there as well, near the obturator foramen. Which structure is located in the inguinal canal of males? The vas deferens. These are all like male body parts, so you can't just do the process of elimination that way. The blank portion of uterine tubes opens directly into the peritoneal cavity, so I think it's distal. It is distal. What structure is H? That looks like an artery. That looks like an artery, so I think it's either iliac, like right common iliac artery, or femoral artery. The correct answer is femoral vein. Oh, you know what? It's oval shaped, so I should have known. And this is the head of the femur, so you know that is the femoral vein. Then what is I in this image? So we know if that's the femoral vein, then that must be the femoral artery. Femoral artery. So I think I just picked this again to be consistent because I really didn't know. But here's the head of the femur. That's round, that's oval, so this is the femoral artery and this is the femoral vein. What is the weighting of this image? T2 weighting. So water is bright on T2 weighting. Which structure does the ejaculatory duct merge with prior to emptying in the prostatic urethra? The vas deferens. Okay, sure. So the ejaculatory duct merges with the vas deferens and then empties into the prostatic urethra. What structure is B? That looks like a muscle in the front of the belly. So rectus abdominis? Yes. What structure of the male reproductive system secretes a thin alkaline fluid into the seminal fluid? The prostate gland. Okay, so I know that glands tend to secrete things, so maybe that's the only reason I guessed that, because I'm not very strong on male reproductive anatomy. Which muscle forms the major part of the pelvic diaphragm? The coccygeus. So a lot of the muscles on the pelvic floor attach to the coccyx. The blank is located between the uterus and the rectum, the retrouterine pouch. Oh, sorry, rectouterine pouch. Okay. Recto meaning rectum, uterine meaning uterus, so yeah. What structure is D? Looks like the ASIS. anterior superior iliac spine. That's easy to remember because if you've ever worked in x-ray and you've had to dig around on a more hypersthenic patient, it doesn't matter where their belly is. You can always look under this fold and find like a bony part, or like, I guess you just have to get a hang of it, but you know that it's right here. If you can look at the curves of the person's body, or later in your career, you just look at them and you imagine where it is. You don't even have to touch the patient. You just know. So just, if you look at the shape of this person, you can tell what structure is indicated as J. So here is a bladder, here is a rectum. And the answer is rectouterine pouch. I guess I don't know. I don't know from this angle because there's also the vesicouterine pouch. I think I could get it right on a sagittal image, but I'm just gonna have to memorize this because honestly, I don't really see, I don't know what I'm looking at here, to be honest. So I just have to go back and look at those from different angles and memorize them. What structure is F? That is a muscle that looks like it's going across the ilium. And the answer is iliopsoas muscle. Which pulse sequence would best demonstrate bony metastatic disease in the sacrum? Stir. So stir is really good for bone bruise and also metastatic issues in the bones. At what threshold is the corpus luteum no longer considered a follicle, but rather a cyst? I don't know, which is why I got it wrong. The correct answer is 20 millimeters. So when the corpus luteum reaches 20 millimeters, it becomes a cyst rather than a follicle. Sorry, I got that backwards. Follicle, cyst, corpus luteum. And I'm going to look that up later. Looks pretty gross. Yeah, we'll have to save that for later. Where was I? Okay, 20 millimeters. What does BPH stand for? Benign prostatic hyperplasia. It's just the prostate gets really big when you get old for no reason. External and internal iliac veins merge near which structure to form the common iliac vein? The sacroiliac joint. I think I guessed on that one, but now we know. What structure is identified as L in this image? Pubic symphysis. Which of the following does not contribute to the uterine wall? Well, I know the uterine wall is the endometrium, myometrium, and perimetrium. So if it's not one of those, it's the perineum. Can be ruled out. The blank is tightly coiled structure that stores sperm for the final stages of maturation. I think that is the seminal vesicles. I was wrong. Oh wait, what did I do here? The correct answer is the epididymis. Okay, so I just need to review the male reproductive organs. The epididymis is a tightly coiled structure that stores sperm for final stages of maturation. I'm going to remember that because epididymis sounds like a funny word that a child would make up, epididymis. And so that person who made up this word needs to mature, okay? So that's how I'm going to remember that. The epididymis is a goofy word You know how kids make up their own language? They just start making up words for stuff. They say Paschetti instead of spaghetti. Right, that's epididymis. So what structure is indicated as K in this image? What are we looking at here? K. I don't know, but that is a structure that looks like it's forming a bridge between the coccyx and the ischium. I think that's the ischium. If you scroll a little bit further up, it turns into the ilium. So there's not like a clear breaking point that I'm really have memorized. So I said coccygeus muscle and I got it right just because I know that it attaches to the coccyx. So I guessed. What structure is M? Looks like a muscle. It looks like it's part of the pelvic floor. The correct answer is obturator internus muscle. Okay? Obturator internus. Pectineal line is located on the upper surface of the superior blank ramus. Pubic. Pectineal line is located on the upper surface of the superior pubic ramus. They both start with P. Pectineal and pubic. That's how I'm going to remember it. If I can't visualize it, I just need to memorize it. And so, pectineal line, pubic ramus. What plane is this image in? That's a sagittal. That was a giveaway question. What structure is identified as G? Labia majora, which just means major lip. So outer lip. Which structure functions to support the pelvic organs in females and can result in prolapse of pelvic organs if torn during childbirth? The answer is perineal body. Those also both start with a P. Prolapse, perineal. Prolapse, perineal. Honestly, I didn't memorize what a perineal body is. I don't remember going over that. The blank are the finger-like projections of the infundibulum that spread loosely over the surface of the ovaries. Fimbriae. 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 They're really gross looking, fimbriae, but I remember that's what they are. Finger-like, fimbriae. What structure serves as a topographic landmark of a posterior prostate in males and vaginal vault in females? I don't know. But it is the transverse Kohlrausch's rectal fold. I guessed that one correctly because when I was looking through the textbook, I saw that this rectal fold was labeled. It's not the first rectal fold, but it's the second rectal fold inside of the rectum. And I just wondered why that's there. So that's how I guessed that one right. What structures do the anal triangle and urogenital triangle combine to create? Pelvic floor? The perineum. Oh, I guess the perineal body is just referring to the perineum in general. Okay, whatever. What group of ligaments prevents posterior movement of the uterus? I think it's the round ligament. I literally read that like 10 minutes before taking the test. So yeah, crash studying does work. Cramming. What is the weighting of this image? It is a T2. How do you know that? Well, because you just do, okay? All right, next question. What structure joins with the duct of seminal vesicles to form the ejaculatory duct? The vas deferens, clearly. The vas deferens joins with the duct of the seminal vesicles to form the ejaculatory duct. Okay. What is the plane of this image? That is coronal. That was another giveaway question. What is the largest vein of the body? The inferior vena cava. All right, which of the following is not a zone of the prostate? The transverse. Okay, you have the central, transition, and peripheral. Inner, medium, outer. Transverse is not one of them, okay? One of the techs just explained this to me randomly one day. She just donated some information to me and I got to use it. What pathology is demonstrated in this image? Something going on right here. Uterine leiomyoma. Well, the uterus is supposed to be here, and this looks like, I'm not really sure what that is, so that's how we know it is something wrong with the uterus. The bladder looks normal because it's kind of just round, clear borders, clear outline. So that one was easy to do just by process of elimination. What is the weighting of this image? That's a T1. Fat is bright right here. Looks like it was tried to be like, they tried to do like fat suppression, or like, I'm sorry, like fat sat. And it kind of shows up here that fat was supposed to be bright, even though it's all overall grayish. But that is a T1. What condition occurs when endometrial tissue is located outside of the uterine cavity? That's endometriosis. I just know that because a few of my friends have had endometriosis. To the following does not contribute to the formation of the oxcox. The sacrum. Which structure transports sperm from the testes? The vas deferens. Okay. Iliac fossa is separated from the body of the ilium by an imaginary line called the arcuate line. I don't know if I'm pronouncing that right. Arcuate line. Male urethra can be divided into how many sections? 3. Don't ask me to name them. I forget already. Which coil is most useful when scanning the prostate? The flex coil, body coil? Oh yeah, that's right, endorectal coil. Looking at the prostate, you have to stick something up your butt, and that helps to see because that's the closest that you can get your coil to the region of interest, the prostate. The upper portion of the acetabulum is formed by the ileum. What condition results from the invasion of endometrial tissue into the myometrium? Adenomyosis. Myo is here, myo is here. And that's it.